Welcome. So if you're looking for an online therapist to help you with your OCD or other anxiety disorder, please contact me and tell me more about yourself and how I can help you, and what you've tried so far. So I teach mindfulness therapy online over Skype for working with anxiety and depression, and also obsessive-compulsive disorder. So online therapy is an excellent option for you to consider, as long as you use Skype. You must use a video platform like Skype or Zoom or FaceTime so that you can see each other. If you can see each other, then the communication is greatly improved, and really there's no difference between meeting online or meeting in person. The style of psychotherapy that I teach, mindfulness therapy, is very effective for treating the underlying process that's causing your anxiety or OCD. It's very important to look at that process and change the underlying habits that cause the reactive thinking that characterizes OCD. Medications are not really a very good solution because they don't help you change anything at that fundamental level, which is psychological in nature. You have to change things there if you really want to break free from any anxiety disorder, and especially if you want to break free from OCD. So during mindfulness therapy, we focus on looking at the structure of our anxiety, of the underlying fear, which is the most prominent emotion that feeds obsessive thinking and rumination. We have to work with that fear, and we have to change our relationship to it. Typically, people don't have a relationship with their fear or other emotions. They simply avoid them or seek distraction from those painful emotions, or they simply become lost in reactive behaviors, as in OCD, which is really where the reactive emotion of fear gets converted into behavioral reactions as a way of trying to get rid of that fear. And of course that does not work. No matter how many times you repeat the behavior, it will not remove that underlying fear. This is a characteristic of any kind of habitual reactivity, whether it's behavioral, whether it's emotional reactivity, or whether it's cognitive reactivity. You cannot heal fear through reactivity. Instead, we need to build a relationship with that underlying fear that's based on full, conscious, present-centered awareness and compassion. These are the key features of mindfulness, and they are essential if you want to heal OCD. So this is what I'll be teaching you during our sessions together if you choose to work with me. I will teach you how to work with your obsessive emotions and thoughts and behaviors using the well-tested methods of mindfulness therapy. This approach is very effective. I have been teaching it for many years now, and people see very dramatic improvements in a relatively short time certainly within the first 3 or 4 sessions, you should see real improvements. So if you'd like to learn more about mindfulness therapy for OCD and other anxiety disorders, then do please contact me and let's go ahead and schedule a trial Skype therapy session. The first session is always a trial session, which means that if you do not see benefits, then you do not have to pay for that session. You only pay when you are completely satisfied with the outcome of each session that we have together. So please contact me if you'd like to learn more about mindfulness therapy for working with OCD. Thank you.